My name is Misty Hitt, and this is my persuasive speech. What I'm trying to persuade you to do is take better care of your teeth. I work for an oral surgeon's office, so I see people on a daily basis who don't take the proper care of their teeth, and most people think, oh, cavity, it's no big deal. And most of the time they're right. But if you let it get out of hand and you don't take care of it when the problem starts, then it can potentially become a very big deal. So that is what I'm trying to persuade people to do, is start with a small problem and keep it a small problem. Don't let it get bigger. It's better for your health and it's better for your wallet, because once you get to that point, it's very, very, very expensive. Some of the treatments that you have to have. Oral hygiene is learned at a young age. Most of it's taught from your parents. That's where you learn it. They teach you how to brush your teeth. You know, we go and buy your first toothbrush and toothpaste, and you go to your first dental visit, and they teach you about how to brush and how to floss. Most people do brush on a daily basis, but not a lot of people floss. And it's actually very important, because the brushing takes care of what's on the outside of your teeth, but the flossing takes care of what's in between. And that's where bacteria and food tends to get in the crevices, and that's where cavities can start. You need to brush at least twice a day with a soft bristle brush. Make sure you cover all areas of your tooth, front, back, and on the tops. Then flossing, what you need to do is it goes in between your teeth, and you hug the tooth, and you actually go up a little bit in your gum line, and that will get rid of a lot of bacteria. Just doing that will help a lot, and it gets the food out, and it's just good for your health to do that. What can happen if you don't take good care of your teeth? Well, like I've already discussed a little bit, cavities is where it starts. It starts with a small cavity on your tooth, and when you get a cavity, normally your dentist will find that if you go to your regular dental visits. Then, if you don't take care of your teeth, a cavity can become an infection, and I'm going to show you some pictures right now. Some of these people probably do have infection, but these are just pictures of cavities. The arrow, that's a cavity right there, and it's up in the gum line, and I would assume that this person probably has infection. This is actually a child's molar, and that's the cavity, and it's actually broken the tooth because the cavity has gotten so out of control. These areas right here, and you notice that they're on the side of the tooth, these probably could have been prevented with proper flossing, because that bacteria would have gotten, the floss would have removed it. All of these arrows on this picture, those are all cavities. And that tooth is actually broken because the cavity has eaten away so much at it. This one, well, it's pretty clear. I mean, the cavities have eaten away. It's up in the roots now, and it's eating away at the gums and the roots and everything. It's really, really bad. From a cavity, like I said, infection happens. It's when it gets, up in your gums and your roots, and it's very painful. And a lot of times that will turn into an abscess. If you can zoom in, this right here, that bubble underneath that tooth, is a picture of an abscess. And if you go down, this is what that person's mouth will look like with an abscess, because that is all infection and it's swollen. And once you get to that point, if you don't get it taken care of, abscesses, the infection can get into your blood, it can go to your brain, it can go to your heart, and it can cause some major issues that it could potentially kill you if you don't get it taken care of. And you would be so surprised how many people get to that point, and then they're in so much pain, they can't sleep, they can't eat, they can't work, they can't do anything, and it takes that to get them to go to the dentist. And you don't want to let it get to that point, because then most of the time you have to have your teeth extracted, you have to have that drained, and it's very, very, very expensive, versus if they had taken care of it when it first started, they would have just had to have their cavity filled, and that would have been where it stopped. The way you can make, which I've already talked about this a little bit, you just need to have regular dental checkups, every 6 months, especially when they're little, because you want them to be comfortable with going to the dentist and taking care of their teeth. I've already talked about brushing and flossing. I really can't stress how important it is to take care of your teeth and keep a small issue a small issue. A little cavity, it's not a huge deal. Even people who take great care of their teeth are prone to cavities sometimes. You just can't help it. I have had almost all of my molars filled. And I take great care of my teeth. And then some people, like my husband, He's just got good genes because he doesn't floss. You know, he brushes his teeth, but he's never had a cavity in his life. And so, you know, it just depends on genes, a lot of it, but you can also help that along with how you take care of your teeth. So I hope that today you have seen what can potentially happen to you if you don't take proper care of your teeth and brush and floss and keep up with your regular dental visits, because it can potentially be a very harmful deal if you don't get your cavities taken care of. So thank you so much for listening, and this is my speech.